Am I live? Okay. Hello. I am Teresa Canicelis. Um, I am going to be discussing about arthritis, fractures, and amputations. So we're just going to be going over each of those topics. We're going to be discussing how they diagnosed, what are the manifestations for these, um, and what does the teachings look like for each of those, as well as kind of the nurse's role throughout this process. Um, so, the different types of outcomes and treatments and support for that as well. So, we will start off with arthritis. Um, so, arthritis is basically the swelling of your joint or multiple joints in your body. um is basically like in the middle of your joint. It can swell, it can hurt really badly. And the typical types of arthritis is osteoarthritis and rheumatoid arthritis. Osteoarthritis, like these things typically appear and show up as you get older. um they can be hereditary. They run in your family. You do have a higher chance of developing arthritis. Um, Now, for instance, rheumatoid arthritis is an autoimmune disease. So you're more susceptible to having other underlying issues. Your joints can actually pop out of place. In your fingers, you can develop these like big, huge bumps, and they can actually curve over. Um, Now, with osteoarthritis, if you are very, very active, the more active you are, um, like rough with your body, it can sometimes impair like flare ups. And you can go into what they call remission with arthritis as well. Now, you would want to get with a rheumatologist. So, what they would do diagnostically is they would draw your blood. They would look at your blood counts. They want to look at your white blood cells as well as your markers for arthritis, as well as rheumatoid arthritis and any other autoimmune disease. Um, Now, in x ray, if they were to take an x ray, say your hand or your knee, wherever you're having the pain, like your hip, in x ray, you can see the density of the bone. So, for a patient who is suffering from arthritis, the calcification in the bone, it's supposed to have this really nice white look to it. Now, if there's not enough calcification, you get a little bit like darker matter in between the bone, and especially by the joint. You can see inflammation. A lot of times when patients have flare ups, it can also be due to stress or what they're eating, as well as the weather. The weather can also alter their condition, unfortunately. Now, let's see. So, again, they can take medications for arthritis. Be sure to look at the side effects. There can be severe side effects, such as affecting the liver, the kidneys. These are pretty potent drugs. So, if there's any chance you could do it, like, I don't know, like naturally, like turmeric or whatever, that would be great. If not, obviously, you have to explore different options. You can always get like a second opinion, as well as you feel like the doctor is not, giving you the information that you're comfortable with. Definitely get a second opinion. So, now we're going to talk about fractures. So, typically, when a patient has a fracture, this can cause swelling. because what happens to the body is when the bone breaks, it immediately goes into wanting to repair itself. So it naturally will start to swell and then try to it's kind of like if you get a cut, right? The air hits it and it'll try to harden, so it will scab. The body is trying to heal itself, essentially. There are different types of fractures, and I will list those off, such as a stable fracture. It's the two ends of the broken bone, they can match up together. So when they take an x-ray, they can see that the bones will set nicely and you won't have like so much of a problem for healing. Now, we have what we call an open compound fracture. Now, that's if the bone is piercing through the skin. That is called an open fracture. So, therefore, you can probably see bone marrow. There's exposure to more of infection, and it's a little bit of more of a heavy recovery. There's also comminuted fracture, which basically the bone is shattered into three different places. So a lot of times when you see that is when the patient has some type of a traumatic force to the bone where it is causing that shatter. I worked in a level 1 trauma emergency room. I saw a lot of these different types of fractures, which was like from a healthcare standpoint pretty cool and interesting, like obviously not for the patient. However, this tells us a lot with the anatomy. So for instance, we have parents coming in with children with fractures in their arms. Now, anatomy doesn't lie. So if you have the parents telling you one story and then you see the child and they have what we call a spiral fracture, which can be like kind of a horizontal fracture or an oblique fracture, so to speak, that's where it's diagonal. So that can mean twisting, which is a sign of abuse. That can give the physician and also the nurses a different route of how to take care of this patient and how to provide adequate care for the child and to get the help that they need in that family. Um, and then for amputations, so there's different types of like criteria, I guess, the patient has to meet in order to obviously require a limb amputation. So I'm just going to list off a few of them. It could be a cancerous tumor at the limb if the patient suffered from frostbite or gangrene, um, peripheral artery disease. They can have blockage in their arteries, therefore, like the foot or the leg is not getting the circulation that they need. Diabetes uh, is one of the biggest ones. Is if you're diabetic, you can be more prone to sores on the bottom of your feet. That's one thing that the doctor will always tell you. Make sure you're looking at the bottom of your feet. Make sure that you can check if there is a sore. You notify your doctor so you can treat it properly because it's harder for diabetics to heal. It takes longer, and they also get what we call neuropathy, which is they don't have feeling in their foot. So, because of those dead nerve endings, you have a lot of patients and who unfortunately start losing their toes or start losing their feet or their legs, depending on how severe the damage is. So, again, there's different criteria that they would obviously have to meet and what that actually looks like. So, one nursing diagnosis, I would say, let's see. we'll do the fractures. So in a case for a patient to be at risk for a fracture would be due to, like a physical activity or a fall, as evidenced by a shattered compound fracture. Um, More elderly people have a high risk of falling, so they would have, unfortunately, a high risk of fracturing their hips or pelvis. Um, Two of the outcomes could either be physical therapy if they're not a good candidate for surgery or occupational therapy, or surgical. Um, they could repair the hip and put in a complete hip replacement, and then they just follow up with their uh, what's it called? Their ortho doc. I can't even think of it. And then yeah, so the two interventions for the evaluation and the plan is basically to educate your patient, let them know what they're in for. If it's arthritis, okay, what are the things that they need to be aware of? What kind of foods do they need to eat? And what kind of medicine do they need to have? What does a flare up look like? Can they go in remission? What does remission look like? With fractures, they can discuss what to look for. If it starts to feel hot and swelling, make sure you get into your physician and let them know there might be an infection. There might be something else going on. If they had surgery and they had to get it wrapped, like maybe the body is rejecting some of the hardware that was placed. So to be aware of those type of things, or to be aware of how long recovery will be and how long they would have to do physical therapy. And then for the same of amputation. So to make sure that the patients understand that there can be something they called phantom pains. So they can have pain still in their lower extremities or even their upper extremities, where they can still feel that appendage. Even though it's not there, they can feel it and they can experience pain in there. So, to understand what that is like and how to cope and manage that as well. Um, I think those are great resources and things to discuss with the patient and have them understand. Um, so, yeah, that concludes my video.